I'm Dr. Maya Patel, an ophthalmologist at Crescent Eye Clinic, where I've dedicated over 15 years to the care and treatment of a wide spectrum of ocular diseases. My journey in ophthalmology has afforded me countless moments of wonder, from the delicate intricacies of retinal surgery to the nuanced management of autoimmune eye disorders. Yet, despite all the experience and knowledge accumulated over the years, there remains a profound sense of humility in the face of the eye's mysteries. The human eye, after all, is a marvel of biological engineering, a structure both fragile and resilient, capable of revealing so much about a person's health and yet still holding secrets beyond our grasp. Crescent Eye Clinic is a place that prides itself on excellence. Equipped with the latest diagnostic tools, high-resolution optical coherence tomography, advanced slit lamp biomicroscopy, and state-of-the-art imaging modalities, we strive to offer patients the most precise and comprehensive eye care possible. Our team, composed of specialists in cornea, retina, glaucoma, and neuro-ophthalmology, works collaboratively to unravel complex cases that challenge conventional understanding. It is within this environment of scientific rigor and compassionate care that I encountered a case that would deeply unsettle my understanding of ocular physiology, a case that still lingers in my thoughts. Throughout my years of practice, I have seen nearly every common eye condition imaginable: cataracts clouding vision, diabetic retinopathy threatening sight, and glaucoma silently stealing peripheral fields. I have treated inflammatory conditions, infectious keratitis, and congenital anomalies, each case sharpening my diagnostic skills and my appreciation for the delicate balance that maintains ocular health. Yet, there are rare instances when the eye behaves in ways that defy textbook explanations, reminding me that medicine is as much an art as it is a science. It was during one of those routine clinic days that I first met Alan Brooks, a patient whose presentation seemed, at first, ordinary, but who would soon lead me into uncharted territory. Alan was a middle-aged man who came to Crescent Eye Clinic with mild, nonspecific complaints about his vision. He described a slight blurriness, occasional eye strain, and some redness that had developed over the past week. Nothing about his symptoms suggested urgency or alarm. There was no pain, flashes, or sudden vision loss. His medical history was unremarkable: no history of trauma, no known allergies, and no chronic illnesses. He was a professional in his 40s, living an active lifestyle with no prior eye issues. In many ways, Alan represented the typical patient whose symptoms might ultimately be attributed to benign causes: dry eyes, environmental irritants, or perhaps early allergic conjunctivitis. On initial examination, I found his visual acuity to be near normal, and aside from a slight conjunctival injection, his anterior segment appeared healthy. The corneas were clear, pupils reactive, and the intraocular pressures within normal limits. Fundoscopic examination revealed no abnormalities. There were no signs of infection or inflammation that would explain his redness or discomfort. The initial impression was that his symptoms might be related to mild irritation or environmental factors, and I recommended a regimen of artificial tears and avoidance of potential allergens. I also ordered some routine tests to rule out subtle causes. Tear film analysis and allergy screening were among them. As I prepared to explain the plan to Alan, I noticed something unusual. His eyes, which moments earlier had been a warm shade of brown, began to subtly shift in hue. It was barely perceptible at first, a faint lightening at the periphery of the irises, but within minutes, the color deepened into a striking, vivid green. The transformation was gradual, but unmistakable. I blinked, certain that it was a trick of the examination room lighting, or perhaps a reflection off the instruments. I adjusted the ambient light, checked the positioning of the patient, and even asked Alan to look away and then back. Yet the change persisted. Such spontaneous changes in iris coloration are extraordinarily rare. The iris, composed of pigment cells and muscular tissue, typically maintains a stable color throughout adulthood, save for gradual changes associated with age or certain systemic conditions. Temporary shifts of this nature are almost unheard of in clinical practice, and certainly not during a routine examination. As I observed Alan's eyes, I felt a mixture of curiosity and unease. What would be causing this? Was it a benign phenomenon or a sign of an underlying pathology? My first thought was to rule out external factors that might simulate a color change. Could there be colored contact lenses, perhaps unnoticed or undisclosed? Alan assured me he wore no lenses of any kind. Could medications or topical agents have caused pigmentation shifts? His history revealed no recent use of drugs known to affect iris coloration, such as prostaglandin analogs used in glaucoma. Could lighting conditions or reflections be responsible? I experimented with various angles and sources of illumination, but the green hue remained consistent. Intrigued and concerned, I proceeded to perform a detailed slit lamp examination, focusing on the iris stroma and pigment epithelium. There was no evidence of iris atrophy, neovascularization, or nodules. The pupil size and shape were normal, without distortion or irregularity. The anterior chamber was quiet, with no signs of inflammation or cells. I ordered anterior segment photography to document the phenomenon, knowing that visual records would be critical for further analysis and consultation. Despite my exhaustive evaluation, the cause of the color change eluded me. I reached out to my colleagues at the clinic, sharing the images and observations. Specialists in ocular immunology, neuro-ophthalmology, and even ocular genetics reviewed the case, but found no immediate explanation. The rarity of transient iris color change, especially in the absence of systemic or ocular disease, left all of us puzzled. This bewildering presentation sparked a deeper reflection on the complexities of ocular pigment biology. Iris color is determined primarily by the concentration and distribution of melanin within the anterior border layer and stroma. While genetics largely dictate baseline pigmentation, environmental influences and pathological processes can induce changes. Though typically these are gradual and unidirectional, such as darkening with age or depigmentation in conditions like Fuchs' heterochromic iridocyclitis. The mechanisms that might produce a rapid, reversible shift from brown to green remain speculative at best. As an ophthalmologist, I am trained to seek patterns, to correlate clinical findings with known pathologies, and to apply evidence-based interventions. Yet, this case defied conventional frameworks. It forced me to confront the limits of current understanding and to acknowledge the possibility of undiscovered physiological mechanisms at play. Was it a novel biochemical phenomenon altering the light-reflective properties of the iris? Could it be a neurological influence modulating iris muscle tone and pigment dispersion? Or perhaps a transient alteration in systemic factors influencing ocular tissues? In the days that followed, I found myself revisiting Alan's case repeatedly, analyzing the images and reviewing literature for any precedent. The experience reminded me that, despite advances in ophthalmology and the sophistication of our diagnostic tools, the eye still holds secrets. Every patient encounter is an opportunity not only to heal, but to learn, to expand the boundaries of knowledge through careful observation and thoughtful inquiry. Alan's case was about to take me on an unexpected journey, challenging my assumptions and inviting me to explore the frontier of ocular science. It was a stark reminder that in medicine, certainty is often elusive and humility is essential. As I prepared to delve deeper into this enigma, I remained committed to supporting Alan, both as a patient and as a fellow traveler into the unknown realms of human biology. Alan Brooks was a man of quiet demeanor, his presence unassuming as he entered the examination room that day. When he first spoke to me, his voice carried a mild concern, tempered by a rational curiosity. His complaints were simple, almost mundane: slight blurriness, occasional eye strain after long hours at the computer, and a redness that had appeared recently without any obvious trigger. There was no history of trauma, no flashes or floaters that might hint at a retinal issue, and no pain that would raise alarms. These kinds of symptoms are common in a society increasingly tethered to screens and artificial lighting, and initially, Alan seemed like many other patients I encounter daily. His medical background was unremarkable. He reported no chronic illnesses, no known allergies, and no family history of eye diseases. Alan was not on any medications, and he lived an active lifestyle, balancing work and leisure with ease. When I checked his visual acuity, it was near perfect, 20/20ths in both eyes, and the intraocular pressures were comfortably within normal range. The anterior segment examination revealed only mild conjunctival redness, likely the cause of his discomfort, but nothing that suggested a serious underlying pathology. The pupils were equal and responsive, and the corneas were clear and intact. Fundoscopic examination showed healthy optic nerves, vessels, and retina, without signs of diabetic changes or hypertensive retinopathy. Given the benign nature of the presentation, I initially suspected mild conjunctivitis or perhaps early dry syndrome. I ordered some routine tests, including tear film breakup time to assess ocular surface stability and an allergy panel to exclude seasonal or environmental allergens. I recommended lubricating eye drops and advised Alan on proper screen hygiene. The 20-20-20 rule to reduce strain, proper lighting, and regular breaks. It was a straightforward plan for what seemed to be a common and manageable condition. However, as I prepared to conclude the examination, something extraordinary happened. Alan's eyes, which had appeared to be a warm, consistent brown, began to change, slowly at first, then more noticeably. The shift was subtle and gradual, almost like watching a painting's colors morph imperceptibly under shifting light. His irises transitioned from their usual brown tone into a vivid green, a hue so striking it seemed almost surreal. The transformation was not fleeting. It unfolded over several minutes while he sat calmly in the chair, and it was undeniably real. I blinked in disbelief. At first, I questioned my own perception. Was this an optical illusion caused by the clinic's lighting, a reflection, or perhaps a camera artifact? I immediately adjusted the overhead lights, moved Alan to different positions, and re-examined his eyes with the slit lamp. Yet the change persisted. The green coloration was uniform and deep, not patchy or inconsistent, ruling out possibilities like pigment dispersion or focal iris atrophy. Alan himself noticed the alteration, his expression shifting from calm to puzzled. "Is this normal?" he asked quietly, his voice tinged with uncertainty. I found myself searching for reassuring words, though I had none to offer beyond honesty. "It's very unusual," I said gently. "We don't often see the iris color change like this so suddenly. I want to run some tests to understand what's happening." Alan nodded, his demeanor steady despite the novelty of the situation. He seemed curious rather than alarmed, though I could sense a flicker of anxiety beneath his calm exterior. The eyes are deeply personal, their color often tied to identity and self-image. To witness such a transformation in real time was understandably unsettling. I quickly arranged for high-resolution anterior segment photography to document the phenomenon. The images captured the striking contrast between the brown and green hues, providing visual evidence that could be shared with colleagues and specialists. I also scheduled a series of diagnostic tests, including iris fluorescein angiography to assess the vascular structures, anterior segment optical coherence tomography to examine iris thickness and layers, and blood work to rule out systemic causes such as inflammatory or autoimmune conditions. Throughout the examination, I spoke with Alan about what we knew and didn't know. I explained that iris color is primarily determined by the amount and distribution of melanin within the stroma and anterior border layer, and that rapid changes in pigmentation are exceedingly rare. I reassured him that we were committed to uncovering the cause, and that his vision, at least for now, was stable and unaffected. Despite my efforts, the clinical picture remained perplexing. The mild redness that had brought Alan in was overshadowed by this unexpected and unexplained color shift. We discussed potential explanations, from benign phenomena like physiologic anisocoria or subtle lighting effects, to more complex possibilities including neurological influences, pigmentary dispersion, or even rare genetic mutations affecting melanin synthesis or distribution. Yet, none of these fully accounted for the rapidity and reversibility of the change. Alan's case quickly became a topic of discussion within Crescent Eye Clinic. I consulted with Dr. Lillian Shun, our neuro-ophthalmologist, who considered the possibility of autonomic nervous system involvement affecting iris musculature and pigment exposure. Dr. Raj Patel, our ocular immunologist, reviewed Alan's blood work and found no markers for systemic inflammation or autoimmune disease. Geneticists at a nearby research hospital expressed interest in analyzing Alan's DNA for rare mutations, but cautioned that such investigations could be lengthy and inconclusive. Throughout this process, Alan displayed remarkable composure. He maintained his daily routine, continued work without interruption, and attended follow-up appointments punctually. His mild anxiety was understandable, but he expressed trust in the medical team and a willingness to participate in ongoing evaluations. I admired his resilience and openness, qualities that made the clinical uncertainty easier to navigate. The psychological impact of such an unusual change should not be underestimated. The eyes are often described as windows to the soul, and their color can be intimately tied to one's sense of identity and confidence. I could see in Alan's eyes a blend of curiosity and apprehension, a desire for answers tempered by the realization that medicine sometimes offers more questions than solutions. It was a poignant reminder that behind every clinical mystery is a person grappling with the unknown, seeking reassurance and understanding. As the initial shock wore off, I remained focused on the clinical details, determined to gather as much data as possible. We scheduled regular visits to monitor the color change, ocular health, and any new symptoms. Alan agreed to maintain a diary of his experiences, noting any factors that preceded or accompanied the shifts in iris color. This case, simple in its beginnings but extraordinary in its evolution, challenged the boundaries of my knowledge and the assumptions of ocular physiology. It was a vivid example of why medicine demands not only expertise, but also curiosity, patience, and empathy. Alan's presentation, with its subtle onset and dramatic visual manifestation, would become a catalyst for deeper investigation, not only into his health, but into the very nature of eye color and its potential variability. As I reflected on that day, I realized that the story was just beginning. Alan Brooks, a man who arrived with mild vision complaints and little expectation of anything unusual, had become the focal point of a medical enigma that would test the limits of contemporary ophthalmology. It was a reminder that in the practice of medicine, even the most routine encounters can unfold into extraordinary journeys, revealing the complexity and wonder of the human body in ways we least anticipate. The transformation in Alan's iris color was slow, deliberate, and undeniably real. Over the course of several minutes during his examination, I watched as the once warm brown eyes gradually shifted to a vibrant green, a hue so vivid it seemed almost otherworldly under the clinic's bright lights. It was not a fleeting illusion or a trick of the environment. This was a physiological change occurring right before my eyes, and it left me both fascinated and deeply unsettled. I instinctively began to question every variable. The first step was to rule out any external factors that might create the appearance of a color change. Was this a reflection from something in the room? A subtle alteration in the clinic's lighting? Perhaps the angle of the slit lamp or the camera flash could be distorting the color. I adjusted the illumination multiple times, moving Alan's head and repositioning the equipment, but the green iris persisted in every light condition and from every angle. I considered the possibility of cosmetic contact lenses, a not uncommon cause of sudden iris color changes, but Alan firmly denied wearing any lenses, and on close inspection, there was no evidence of a lens edge or foreign body on the ocular surface. His corneas were pristine, without the microabrasions one might expect from lens wear. I also reviewed his medication history. There were no topical or systemic drugs known to cause pigmentary changes in the iris, such as prostaglandin analogs used in glaucoma therapy, which can darken the eyelashes and periocular skin but rarely alter iris color so dramatically or rapidly. The slit lamp examination revealed no abnormalities to account for this phenomenon. The iris stroma was intact, with no signs of atrophy, neovascularization, or pigment dispersion. The pupil was round and centrally located, with a normal light reflex. No nodules, nevi, or cysts were present. Anterior chambers were clear and quiet, with no inflammatory cells or flare. The ocular surface was unremarkable aside from mild conjunctival injection, consistent with Allen's initial complaints. In short, the eyes appeared structurally normal aside from the inexplicable color shift. To further investigate, I employed advanced imaging techniques. Anterior segment optical coherence tomography, ASOCT, provided cross-sectional images of the iris layers, revealing no edema, thickening, or structural disruptions that might explain a pigment change. Iris fluorescein angiography was performed to assess vascular perfusion and integrity, yielding no abnormal leakage or vascular anomalies that might suggest inflammation or neovascularization. The imaging corroborated the clinical impression of a structurally intact iris, yet the color had undeniably shifted. I consulted with colleagues, sharing the photographic documentation and clinical findings. Each specialist was intrigued, but equally baffled. Dr. Lillian Shun, our neuro-ophthalmologist, speculated on the possibility of autonomic nervous system influences affecting iris muscle tone or pigment granule distribution. She noted that the iris contains two muscles, the sphincter pupillae and the dilator pupillae, which regulate pupil size under sympathetic and parasympathetic control. However, muscle contraction traditionally affects pupil diameter, not iris pigmentation, and no known mechanism explains rapid pigment shifts induced by neural input. Dr. Raj Patel, our ocular immunologist, considered subtle inflammatory or biochemical triggers that might transiently alter pigment presentation. Yet, blood tests showed no signs of systemic inflammation. Autoimmune markers were negative, and Allen reported no systemic symptoms such as fatigue, joint pain, or rashes that might accompany autoimmune diseases affecting pigmentation. Infectious etiologies were also ruled out, as Allen had no recent illnesses or exposures. The rarity of the phenomenon prompted a review of literature and case reports. I found only sparse references to transient changes in iris coloration, typically linked to conditions such as Horner syndrome causing heterochromia, pigmentary glaucoma leading to dispersion of pigment granules, or rare genetic mutations causing sectoral heterochromia. None described a rapid, reversible shift of the entire iris color in an otherwise healthy adult. Some anecdotal reports hinted at neurological or biochemical influences, but these remain speculative and unsupported by robust evidence. The possibility of biochemical alterations affecting the melanin within the iris stroma intrigued me. Melanin, the pigment responsible for eye color, is synthesized and stored within melanocytes and pigment granules. While the quantity and distribution of melanin generally remains stable in adulthood, could there be a transient change in the optical properties of the iris? Perhaps a shift in the scattering of light due to subtle changes in stromal hydration or microarchitecture. Such hypotheses remain unproven and difficult to measure, but the phenomenon before me suggested that some dynamic process was at work. Throughout this perplexing assessment, Allen remained composed, watching the color shift in his eyes with a mixture of fascination and mild concern. I sensed his confusion. After all, our eyes are deeply tied to identity, and an unexpected change in their appearance can be unsettling. I reassured him as best I could, explaining the extraordinary nature of the event and our commitment to thorough investigation. We documented the color transition meticulously, capturing high-resolution photographs and videos to chronicle the gradual change from brown to green. These images became an invaluable resource for consultation and for future reference in case similar cases emerged. I also advised Allen to keep a detailed diary, noting any symptoms, environmental exposures, or emotional states that might correlate with the color change. In the days that followed, I pondered the enigma extensively. The iris color change was not merely a curiosity. It challenged fundamental assumptions about ocular physiology. The eye, while accessible to direct observation unlike many organs, still holds mysteries about its pigmentary dynamics. The interplay between genetics, biochemistry, neural control, and environmental factors is complex, and this case underscored the gaps in our understanding. Allen's case became a catalyst for broader discussions among the ophthalmology team. Could this represent a new clinical entity? Might it reveal previously unrecognized mechanisms of pigment modulation? Was it an isolated phenomenon or a signpost toward undiscovered physiological processes? The questions were profound and the answers elusive. As I reviewed the clinical data, I was struck by the humility that such mysteries demand. Medicine often advances through the recognition of anomalies that defy explanation, prompting research and discovery. Allen's shifting iris color was one such anomaly, an invitation to explore the boundaries of knowledge and to embrace uncertainty with scientific curiosity and open-mindedness. While the cause remained unknown, the meticulous documentation and interdisciplinary collaboration set the stage for ongoing inquiry. Allen's eyes, once a simple shade of brown, had become a living puzzle, a vivid reminder that the human body can surprise us in unexpected ways. The green hues shimmering in his irises were not just a clinical curiosity. They were a testament to the complexities woven into our biology, waiting patiently to be understood. Allen Brooks sat quietly in the examination chair, his gaze fixed on the mirror mounted on the clinic wall. As I observed him, I could see the subtle shifts in his expression, curiosity mingled with unease. The transformation of his iris color from a familiar brown to an unexpected vivid green was not just a clinical anomaly. It was a deeply personal and disconcerting experience for him. I recalled how, during our earlier visits, Allen had approached the situation with a calm and rational demeanor. But beneath that composure lay an understandable confusion. The eyes are an intimate part of one's identity, often described as windows to the soul, and to see them alter in such a visible and inexplicable way naturally stirred questions and insecurities. "Doctor," he had asked during one consultation, hesitating slightly, "is this something dangerous? Could it mean there's something seriously wrong with my eyes or my health?" I appreciated his openness and the trust he placed in me. It was a moment that reminded me medicine is not only about diagnosing and treating physical conditions, but also about addressing the emotional and psychological dimensions of illness. I responded with care, "Allen, I understand how unsettling this change must feel. At this point, we haven't identified any signs that suggest a threat to your vision or overall health. Our priority is to monitor your eyes closely and continue investigating the cause." Despite the reassurance, I sensed the lingering anxiety beneath his words. The unpredictability of the color change, combined with the unexplained nature of the phenomenon, made it difficult to provide definitive answers. I encouraged Allen to share his feelings and any concerns he had, emphasizing that his emotional well-being was as important as the physical investigation. Over the following weeks, Allen confided that the color change had led to moments of self-consciousness, especially in social and professional settings. He described subtle but real reactions from colleagues and acquaintances, curious glances, whispered questions, even occasional compliments that highlighted the unusual eye color. While some responses were positive, the novelty of his changing irises sometimes made him feel exposed, as if he were under a spotlight. "I never thought much about my eye color before," Allen admitted during a follow-up visit. "Now, it feels like people notice me differently. Sometimes I like it, but other times it makes me uncomfortable. I'm not sure how to explain it." His honesty was a reminder of the intricate relationship between physical health and personal identity. The eyes, though small in size, hold immense significance in human connection and self-perception. Changes to their appearance can ripple through one's sense of self, affecting confidence and emotional stability. I shared with Allen that such psychological impacts are not uncommon in patients facing unusual or unexplained medical phenomena. The uncertainty, coupled with visible changes, can evoke feelings of vulnerability. I offered support and recommended that he consider speaking with a counselor or psychologist experienced in managing medical-related anxiety if he felt overwhelmed. Allen expressed appreciation for the suggestion, but preferred to focus on the medical investigation for the time being. He remained engaged and proactive, attending all scheduled appointments and adhering to testing protocols. His resilience was commendable, and it reinforced the importance of maintaining a holistic approach to patient care, one that integrates empathy with scientific inquiry. Throughout this period, I also reflected on my own experience as a physician confronted with such an enigmatic case. The limits of my knowledge were laid bare, and I grappled with the discomfort of uncertainty. Yet, I found renewed purpose in the opportunity to accompany Alan through this uncharted territory, offering support even when answers were scarce. In conversations with my colleagues, we discussed the need to remain vigilant for any changes in Alan's visual function or systemic health that might provide clues to the underlying cause. We recognized that while the color change itself was benign in appearance, its mysterious nature warranted careful observation. I documented each visit thoroughly, noting not only the clinical findings but also Alan's emotional state and coping mechanisms. This comprehensive approach was essential in managing a case that transcended traditional diagnostic boundaries. The clinic staff, too, became attuned to the nuances of Alan's experience. From receptionists to technicians, everyone was mindful of the sensitivity required when interacting with a patient facing such an unusual condition. Their professionalism and kindness contributed to creating an environment where Alan felt safe and respected. One afternoon, during a routine checkup, Alan confided in me a personal reflection. "I've always taken my eyes for granted," he said softly. "Now, they feel like a mystery, something I don't fully understand. It's strange to have something so familiar suddenly feel foreign." His words resonated deeply. The eyes, so central to perception and identity, can become sources of both insight and mystery. Alan's journey highlighted the profound human dimension of medicine, the intersection of biology, psychology, and lived experience. As we continued our work together, I remained committed to supporting Alan not only through diagnostic efforts, but also by acknowledging the emotional terrain he was navigating. The unpredictability of his condition underscored the importance of patience, open communication, and the willingness to confront uncertainty with compassion. In this partnership between doctor and patient, the clinical challenge was matched by a shared humanity. Alan's experience served as a poignant reminder that behind every medical mystery lies a person seeking understanding, reassurance, and connection. It is this bond that sustains the practice of medicine, especially when the path forward is uncertain. At Crescent Eye Clinic, we pride ourselves on having some of the most advanced diagnostic capabilities available in ocular medicine. Yet, Alan's case pushed us to employ every tool at our disposal and to think beyond standard protocols. The shifting iris color was not just a clinical curiosity. It demanded a thorough scientific investigation into pigment dynamics and systemic influences. Our laboratory team sprang into action, coordinating a series of specialized tests designed to probe the biochemical and physiological underpinnings of Alan's unusual presentation. One of the first areas we explored was the possibility of pigment alteration at the cellular level. Iris pigmentation is primarily determined by melanin, produced by melanocytes within the stroma and anterior border layer of the iris. Any change in the quantity, distribution, or optical properties of melanin could theoretically alter eye color. To investigate this, we collected tear samples and peripheral blood to analyze for biochemical markers that might reflect pigment metabolism or systemic processes influencing melanin synthesis. The lab ran assays measuring levels of tyrosinase activity, the key enzyme in melanin production, as well as melanin precursors and metabolites. We also tested for markers of oxidative stress and inflammation, given that such factors can impact cellular function and pigment integrity. Despite these comprehensive efforts, the results came back within normal ranges. There was no evidence of systemic inflammation, pigmentary disorders, or metabolic abnormalities that could account for the rapid and reversible color change. Simultaneously, we expanded our focus to include neurological and biochemical pathways that might exert influence over the iris. The autonomic nervous system regulates the iris muscles, and neurotransmitters such as norepinephrine and acetylcholine modulate pupil size and, potentially, pigment dispersion. Could fluctuations in neural signaling or neurotransmitter levels be driving the transient color shifts? To explore this, we arranged for Alan to undergo neurological evaluations and biochemical profiling of catecholamines and other relevant neurotransmitters. Neurological assessments, including nerve conduction studies and autonomic function tests, revealed no abnormalities. Alan exhibited normal pupillary reflexes and no signs of dysautonomia. Blood and urine analyses for neurotransmitter metabolites were unremarkable. These findings suggested that while neural mechanisms regulate pupil dynamics, they were unlikely to explain the pigmentary changes observed. The complexity of ocular pigmentation led us to consider rarer possibilities. Could a biochemical trigger, perhaps an environmental factor or an unidentified systemic agent, be influencing pigment appearance? We inquired extensively into Alan's lifestyle, exposures, diet, and emotional stressors. He reported no changes in medications, no exposure to unusual chemicals or allergens, and no significant stress episodes correlating with the color changes. His overall health remained stable. One intriguing hypothesis was that transient alterations in iris stromal hydration or microstructure might affect light scattering properties, thus changing perceived color without altering pigment content. While this concept is theoretically plausible, it remains difficult to measure directly. We turned to advanced imaging techniques, utilizing high-resolution anterior segment optical coherence tomography and confocal microscopy to detect subtle stromal changes. The images revealed no discernible edema, cellular infiltration, or structural disruption. Our exploration extended to systemic diseases known to affect pigmentation, such as endocrine disorders and autoimmune syndromes. Thyroid function tests, adrenal hormone profiles, and autoimmune panels were all within normal limits. Alan's general medical examination and laboratory workup showed no signs of systemic illness. Throughout this investigative process, I reflected on the remarkable complexity of ocular pigmentation biology. The iris is not a static structure. It possesses dynamic qualities influenced by genetics, environment, and potentially unknown systemic factors. Yet, the mechanisms governing these interactions remain only partially understood. Alan's case highlighted the limitations of current knowledge and underscored the need for ongoing research. I engaged in extensive literature review and discussions with experts in ocular biology and pigmentary disorders. While transient eye color changes are sporadically reported in anecdotal and historical accounts, systematic studies are scarce. Most documented cases involve permanent or progressive changes linked to disease, trauma, or medication effects. The concept of reversible, spontaneous iris color shifts in a healthy adult is virtually unprecedented. This realization emphasized the importance of cautious interpretation and the avoidance of premature conclusions. It also inspired me to consider broader scientific collaborations. I reached out to researchers specializing in melanocyte biology, neuro-ophthalmology, and pigment biochemistry, sharing Alan's clinical data and images. The goal was to foster multidisciplinary dialogue and perhaps stimulate targeted investigations that could shed light on this phenomenon. Meanwhile, at Crescent Eye Clinic, we continued meticulous monitoring of Alan's condition. Regular follow-ups included detailed photographic documentation, comprehensive ocular examinations, and updates on systemic health. Alan remained engaged and cooperative, his resilience a source of encouragement. The ongoing uncertainty invited philosophical reflection on the nature of medical knowledge. Medicine thrives on patterns and predictable responses, yet cases like Alan's remind us that human biology can defy expectation. Embracing the unknown requires scientific rigor balanced with humility, a willingness to recognize the boundaries of understanding and the need to explore beyond them. As I pondered the intricacies of iris pigmentation and the elusive factors influencing it, I was reminded of the eye's profound symbolism. It is a window not only to the external world, but also to the complex interplay of genetics, physiology, and environment within ourselves. Alan's shifting iris color became more than a medical puzzle. It was an invitation to deepen our appreciation for the mysteries woven into human biology. In the clinic, I discussed with Alan the limitations of current knowledge and the importance of ongoing observation. I acknowledged the frustration of uncertainty, but emphasized our commitment to supporting him through this journey. Together, we navigated the delicate balance between scientific inquiry and compassionate care. This case has since fueled my enthusiasm for research and education in the field of ocular pigmentation. It has inspired conversations among colleagues and trainees about the dynamic and sometimes unpredictable nature of the eye. Alan's experience stands as a testament to the evolving landscape of medicine, where curiosity, perseverance, and empathy converge in the pursuit of understanding. During one of Alan's scheduled follow-up visits, something unexpected unfolded, a reversal of the very phenomenon that had so perplexed us all. As I greeted him and prepared for the routine examination, I noticed immediately that the vivid green hue which had so recently dominated his irises was now retreating. Gradually, almost imperceptibly at first, the color shifted back to the familiar warm brown that had defined Alan's eyes for decades. The transition was as gradual as the initial change had been, yet no less remarkable. Over the span of several minutes, his irises faded from green through varying shades, finally settling into the original brown tone. This spontaneous reversal was entirely without intervention. Alan had taken no new medications, experienced no noticeable changes in health, and reported no environmental exposures that might explain it. The eyes, which had been an enigma in their transformation to green, now returned to their baseline state with equal mystery. I documented this event meticulously. Photographs and videos recorded the progression, capturing the subtle nuances of the color shift. These images became invaluable, providing a comprehensive visual timeline of both the outward and inward transformations occurring within the iris. The spontaneous nature of the reversal added a new layer to the enigma. It suggested that the phenomenon was dynamic and perhaps reversible, rather than permanent or progressive. This raised questions about the underlying mechanisms responsible for the color changes. Could they be fluctuations in pigment presentation, neuromodulation, or microstructural alterations within the iris? The absence of pathological signs or systemic illness reinforced the notion that we were witnessing an unusual physiological process rather than a disease. I shared the observations with Alan, who expressed relief mixed with renewed curiosity. "It's strange," he said softly, "to see my eyes change like this, then change back. It feels surreal, like they have a life of their own." His words reflected the profound impact this phenomenon had on his sense of self. The eyes, as ever-present features, carry deep personal and social meaning. Their alteration, even temporarily, can unsettle identity and provoke reflection. Alan's experience was a vivid reminder of the intricate relationship between physical appearance and psychological well-being. In the clinic, the reversal sparked lively discussion among the team. We revisited previous hypotheses in light of the new information. The fact that the color change was reversible suggested mechanisms involving transient modulation rather than permanent pigment alteration. Possibilities included dynamic changes in stromal hydration affecting light scattering, reversible redistribution of pigment granules, or neural influences on iris musculature that might subtly alter the appearance of pigmentation. Despite the rich clinical data and imaging, no definitive explanation emerged. The reversal underscored the limits of current scientific understanding and the need for cautious interpretation. It also highlighted the importance of longitudinal observation in such atypical cases, where patterns may reveal themselves over time. I reached out again to specialists and researchers, sharing the updated findings. The case continued to spark interest, underscoring its rarity and potential significance. Discussions emphasized the value of documenting such phenomena rigorously, as they may hold clues to broader physiological principles yet to be elucidated. Throughout this period, Alan remained engaged and cooperative. He maintained detailed notes of any subjective changes, lifestyle factors, or emotional states that might correlate with the iris color shifts. His proactive involvement was instrumental in guiding our investigative approach. The spontaneous reversal also brought a measure of hope and reassurance. It indicated that, at least for now, the phenomenon did not herald a degenerative or harmful process. Alan's visual function remained stable, and no new symptoms had surfaced. Reflecting on this development, I was struck by the profound humility and wonder that such cases inspire. Medicine often confronts us with puzzles that challenge established paradigms and invite us to expand the horizons of knowledge. Alan's journey was a testament to the dynamic nature of human biology and the continuous interplay between observation, inquiry, and care. As we prepared for ongoing monitoring, I emphasized to Alan the importance of vigilance and communication. While the color shifts had stabilized for the moment, the unpredictability of the phenomenon necessitated continued attention and support. This episode reinforced the vital role of the patient-physician partnership in navigating uncertainty. Together, we embraced the unknown, committed to understanding and managing this rare ocular mystery with empathy, patience, and scientific rigor. Alan's eyes, once again their familiar brown, were not merely a return to baseline, but a symbol of resilience and the evolving narrative of medical exploration. The story was far from over, but this reversal marked a pivotal chapter, one that deepened our appreciation for the complexities of the human eye and the mysteries it holds. In the weeks following the spontaneous reversal of Alan's iris color back to its original brown, a cautious sense of stability settled over his condition. The vivid green hues that had so recently captured our attention faded into memory, and the eyes that once again looked familiar to him and those around him seemed to hold steady. Yet, this newfound steadiness was accompanied by a vigilant watchfulness, a recognition that the mystery had not resolved, but merely entered a new phase of quiet observation. Alan continued to attend regular follow-up appointments at Crescent Eye Clinic, each visit marked by thorough examinations and detailed photographic documentation. We maintained a schedule of evaluations every 2 to 3 weeks, allowing us to monitor for any subtle changes or recurrences of the color shifts. Throughout these visits, his visual acuity remained unchanged, with no evidence of inflammation, structural abnormalities, or other ocular pathology. The anterior segment examinations were consistently unremarkable, aside from the stable brown irises now restored. Despite the absence of further episodes, the uncertainty lingered. The unpredictable nature of Alan's previous color changes made it impossible to predict whether the phenomenon might recur. This uncertainty required a delicate balance, providing reassurance without complacency, encouraging normalcy while maintaining readiness for new developments. Alan himself adapted well to this balance. He reported feeling more comfortable with the situation, having experienced both the transformation and its reversal. He expressed gratitude for the ongoing support and openness the clinic offered, which helped him navigate the psychological impact of the condition. We discussed strategies to cope with any future episodes, including maintaining detailed symptom logs and promptly reporting any changes. The clinical team at Crescent Eye Clinic remained engaged and attentive. Our approach was multidisciplinary, involving ophthalmologists, neuro-ophthalmologists, and ocular immunologists, all collaborating to interpret findings and adjust monitoring protocols as needed. We held regular case discussions, reviewing Alan's data and considering emerging hypotheses that might explain the dynamic pigmentation. The stability also allowed us to explore broader implications. Could Alan's case provide insights into iris physiology and pigment dynamics that extend beyond individual pathology? Was there potential to uncover mechanisms of reversible pigment modulation that might have applications in understanding other ocular or systemic conditions? These questions fueled a spirit of cautious optimism within the team. To this end, we maintained comprehensive records, ensuring that every detail, from clinical observations to biochemical tests, was meticulously cataloged. This repository of information was invaluable not only for Alan's care, but also as a foundation for potential future research. Alan's willingness to participate actively in this process was instrumental. He diligently recorded any subjective changes, environmental factors, or emotional states that might correlate with iris color variations, even during periods of apparent stability. This level of engagement enriched our understanding and underscored the importance of patient collaboration in managing enigmatic conditions. In parallel, we expanded our conversations with researchers and specialists beyond the clinic. Sharing Alan's case at academic forums and through professional networks sparked interest and dialogue. Colleagues highlighted the rarity of transient, reversible iris color changes and the paucity of data in the literature, reinforcing the significance of detailed case reports in advancing medical knowledge. The experience also influenced our educational initiatives. Alan's case became a teaching point for trainees and junior staff, illustrating the necessity of clinical vigilance, interdisciplinary collaboration, and empathy when confronting atypical presentations. It was a vivid example of how medicine often requires embracing uncertainty while striving for understanding. Throughout this period, I reflected on the patient-physician relationship and the qualities it demands: trust, communication, patience, and humility. Alan's journey reminded me that beyond diagnoses and treatments, medicine is fundamentally about partnership and shared resilience in the face of the unknown. While the mystery of Alan's iris color change remained unresolved, the period of stability offered a measure of hope and normalcy. It underscored the value of ongoing monitoring and the readiness to respond should new developments arise. It also highlighted the evolving nature of medical knowledge, where each case contributes to a larger tapestry of understanding. As Alan continued his daily life with steady eyes and steady health, the clinic remained a vigilant steward of his care. The story was one of careful watchfulness and quiet courage, a testament to the enduring quest to unravel the mysteries of the human body, one patient at a time. As weeks turned into months of careful monitoring, it became evident that Alan's case was not only unique, but also ripe for broader investigation. The transient and reversible nature of his iris color changes had captured the attention of my colleagues beyond Crescent Eye Clinic, sparking collaborative efforts to explore potential genetic, neurological, and environmental factors that might contribute to this rare phenomenon. Recognizing the complexity of the case, I reached out to a network of researchers specializing in ocular genetics and pigment biology. Genetic analysis of Alan's DNA was undertaken to search for mutations or polymorphisms in genes known to influence melanin synthesis and distribution, such as OCA2, HERC2, and MC1R. While these genes are typically associated with baseline eye color and pigmentation disorders, we hypothesized that subtle variants or regulatory elements might underlie dynamic pigment modulation. The genetic sequencing yielded no definitive mutations linked to abnormal pigment shifts, but it did reveal some rare variants of uncertain significance. These findings underscored the intricacy of genetic regulation in ocular pigmentation and suggested that if genetics played a role, it might involve multifactorial interactions or epigenetic influences not yet fully understood. Parallel to genetics, the neurological aspect remained a focus. Given the autonomic nervous system's control over iris muscles and potential indirect effects on pigment distribution, we collaborated with neuro-ophthalmologists and neurologists to conduct advanced imaging and functional studies. Functional MRI and autonomic testing sought to detect subtle neural activity or dysregulation that might correspond with episodes of iris color change. These investigations were largely inconclusive, revealing no overt neurological abnormalities. However, the possibility of transient, subclinical neuromodulation remained plausible, especially given the reversible nature of the phenomenon. It highlighted the need for more sensitive and targeted neurophysiological assessments in future research. Environmental factors also entered the frame of consideration. Alan meticulously documented his daily activities, exposures, diet, and emotional states, searching for any patterns or triggers. We reviewed environmental toxins, UV exposure, dietary components, and even psychological stressors that might influence pigmentation or iris physiology. Yet, no consistent correlations emerged. In addition to clinical data, I delved into global ophthalmology literature and rare case reports. Anecdotal accounts and isolated studies hinted at transient eye color changes associated with hormonal fluctuations, certain medications, or systemic conditions like Horner syndrome. However, none matched Allen's presentation in rapidity, reversibility, and absence of underlying pathology. This paucity of documented cases underscored the rarity of the phenomenon and the gaps in scientific understanding. It became clear that comprehensive, multidisciplinary research was necessary to unravel the mechanisms at play. Allen's case stood as a sentinel, inviting the ophthalmology community to explore transient pigment dynamics more deeply. To foster this inquiry, I engaged with academic institutions and research consortia, sharing Allen's clinical data, imaging, and genetic findings. The goal was to catalyze studies that might integrate molecular biology, neurophysiology, and environmental health to elucidate the underpinnings of such unusual ocular phenomena. Within our clinic, Allen's case became a cornerstone for discussions on diagnostic vigilance and the importance of considering rare presentations. It emphasized the value of detailed clinical documentation and the need for openness to the unknown in medical practice. The collaborative exploration also illuminated the challenges of studying phenomena that are transient and unpredictable. Designing protocols to capture episodic changes demands innovative approaches and patient engagement. Allen's cooperation and detailed record-keeping were invaluable in this regard, highlighting the critical role of patient participation in advancing medical knowledge. Reflecting on these developments, I was reminded of the dynamic and evolving nature of medicine. Cases like Allen's serve as catalysts that propel science forward, challenging existing paradigms and inspiring new lines of inquiry. They reveal the profound complexity of human biology and the interplay of genetic, neurological, and environmental factors that shape our physiology. As research efforts continued, I remained committed to supporting Allen through ongoing monitoring and care. His experience stood not only as a medical mystery, but as a beacon guiding us toward deeper understanding and discovery. In this journey, the intersection of clinical observation, scientific curiosity, and patient partnership emerged as the foundation for progress. Allen's case exemplified the spirit of medical exploration, where every unanswered question is an invitation to learn, and every rare phenomenon a window into the intricate tapestry of human health. Allen's case gradually attracted attention beyond the walls of Crescent Eye Clinic, sparking interest within the ophthalmology community both locally and internationally. Presentations at professional conferences became opportunities to share the enigmatic details of his condition, inviting dialogue and debate among experts eager to understand the unusual phenomenon of transient iris color change. At the annual meeting of the American Academy of Ophthalmology, I presented Allen's case alongside detailed imaging, clinical data, and the investigative journey we had undertaken. The response was both enthusiastic and contemplative. Colleagues acknowledged the rarity of such presentations and appreciated the meticulous documentation and interdisciplinary approach. The case stimulated discussions about the limits of current understanding in ocular pigmentation and the need for further research into pigment dynamics. In the months that followed, Allen's story was featured in a peer-reviewed medical journal as a detailed case report. The publication emphasized the clinical findings, diagnostic challenges, and the broader implications for ophthalmic science. It served as a reference point for clinicians encountering unusual pigmentary changes and underscored the importance of maintaining diagnostic vigilance and an open mind. The case also influenced educational initiatives within our institution. Allen's journey became a teaching tool for residents and medical students, illustrating the complexities of atypical presentations and the necessity of comprehensive evaluation. Trainees learn the value of combining clinical acumen with empathy, especially when confronting conditions that defy easy explanation. Beyond the academic sphere, Alan's experience fostered a culture of curiosity and humility among the clinical staff. It reminded us all that medicine is not only about diagnosis and treatment, but also about embracing uncertainty and remaining open to new knowledge. The case reinforced the principle that every patient encounter is an opportunity to learn and grow as practitioners. For me personally, Alan's case deepened my appreciation for the mysteries that persist within ophthalmology and medicine at large. It challenged me to balance scientific rigor with compassionate care, recognizing that some answers may remain elusive despite our best efforts. The experience reinforced the importance of lifelong learning and the willingness to question assumptions. Throughout this period, Alan continued to be an active participant in his care and the broader narrative of his condition. His openness and resilience inspired not only the medical team, but also peers who encountered him. He shared his story at patient advocacy events, emphasizing the importance of partnership between patients and clinicians in navigating rare and uncertain medical phenomena. The ripple effects of Alan's case extended into research conversations, inspiring proposals for studies into transient pigmentation changes and their underlying mechanisms. Collaborations between clinicians, geneticists, neuroscientists, and biophysicists began to take shape, reflecting the interdisciplinary nature of the challenge. In discussing the case with colleagues, I often reflected on the broader lessons it imparted. It was a vivid reminder that medicine is not static, but an evolving discipline shaped by curiosity, observation, and the courage to confront the unknown. Alan's iris color shifts, while medically perplexing, became a symbol of the dynamic interplay between biology and individuality. As Alan moved forward in life, his eyes stable in their familiar brown, the legacy of his experience endured. It influenced clinical practice, enriched educational programs, and propelled scientific inquiry. The case stood as a testament to the power of meticulous observation and the enduring quest to understand the human body's complexities. Ultimately, the story of Alan Brooks illuminated the profound connection between patient and physician, the shared journey through uncertainty, discovery, and hope. It reaffirmed the fundamental tenet of medicine, that every patient is a unique narrative, deserving of attention, respect, and unwavering commitment to care. Alan Brooks continued to live his life with the steady brown of his irises restored, the episodes of sudden color change having receded into a rare and unresolved mystery. Over time, the shifting hues became a chapter in his story that neither defined him nor diminished his vitality. Yet, the experience left an indelible mark, not only on his life, but on my practice and perspective as an ophthalmologist. In the years since Alan's initial presentation, I often reflect on the profound lessons his case imparted. It taught me that medicine is an ever-evolving field, where certainty is sometimes elusive and humility is essential. Despite advances in technology and knowledge, the human body retains its mysteries, reminding us to approach each patient with openness and curiosity. Alan's case reinforced the importance of listening deeply to symptoms, to patients' concerns, and to the subtle signs that may challenge established understanding. It underscored that rare phenomena, however perplexing, deserve careful attention and respect, for they may hold keys to new scientific insights. Incorporating this experience into my clinical practice, I have emphasized teaching the next generation of ophthalmologists the value of diagnostic vigilance and empathy. Alan's journey has become a cornerstone of discussions about atypical presentations, the necessity of interdisciplinary collaboration, and the art of managing uncertainty with grace. His story also inspired new modules in our training programs, encouraging students and residents to embrace complexity and to view medicine not merely as a set of protocols, but as a dynamic engagement with human biology and experience. It reminded us all that behind every clinical puzzle is a person seeking understanding, dignity, and care. On a personal level, Alan's resilience and trust left a lasting impression. His willingness to navigate the unknown alongside the medical team exemplified the partnership at the heart of healing. It reaffirmed the privilege of being a physician, not only to diagnose and treat, but to support and accompany patients through the uncertainties of health and disease. While the precise cause of Alan's transient iris color changes remains unresolved, the case stands as a testament to the evolving nature of medical knowledge. It invites ongoing inquiry and reflects the endless pursuit of understanding that defines medicine. In the quiet moments of reflection, I find that Alan's eyes, once a shifting palette of colors and now steady again, symbolize the resilience of the human spirit and the enduring quest for knowledge. His journey is a reminder that medicine is not solely about answers, but about the journey itself, a commitment to curiosity, compassion, and the hope that every mystery holds the promise of discovery.